Good afternoon, everybody. It's Dr. Galvin with another COVID update. Today we're going to talk about the immunization program for kids who are 5 to 11 years old. Haven't really addressed this in any videos recently. To start it off, my name is Jeffrey Galvin. I'm a board-certified emergency medicine and functional medicine physician who practices I have a clinic in Charlotte, but I also work in an emergency department in the Charlotte region. So I've been dealing with COVID since the beginning. I've been posting videos since it started. So let's talk a little bit about vaccination for kids. So the FDA has approved vaccinations for children ages 5 to 11. And this is sort of a big change. We haven't been able to do that until just recently. And I think a lot of parents are understandably, concerned about COVID, but at the same time, they want to know that what they're going to be doing is safe for their children. So I think we should talk a little bit about what we're talking about in terms of immunization for those kids, why we want to do it, the safety of it, and, hopefully give you some information to make good choices for your own children. The data is pretty good. We've got a number of different studies done, and the majority of studies were done in a randomly controlled trial, which is the ideal way to do it, meaning that some of the kids in the study got immunized and some of the kids got a placebo. So nobody knew who got immunized, who didn't, and then they looked at efficacy and things like that in terms of and side effects based on who got the real vaccine versus who got the placebo. First off, why would we want to immunize kids? Well, even though kids are much less likely to develop, COVID symptoms, and more importantly, severe COVID, we're still seeing something like 100,000 kids a week getting infected with COVID. We've had, millions of kids who have had COVID. We've had, almost 10,000 kids admitted to the hospital with severe COVID, and we've had 150 or so deaths. The other thing is that, there's this multi-inflammatory systemic problem that kids can get related to COVID as well. So a vaccine will prevent those severe side effects, and that's really what the vaccines are for. They're going to prevent the really bad things, hospitalization, severe illness, and death. Children represent a pretty big reservoir for COVID. So a kid goes to school, gets exposed, comes home, and can potentially give it to other people who may have not been vaccinated, may have an immunocompromised situation, or maybe a much higher risk. So if we get kids vaccinated, it raises the population vaccination rate, and it kind of helps everybody. So there's a couple reasons for why to do it. The dosage in this age group is about a third of the adult dosage, so it's a lot less. But the immunogenicity of it, meaning your ability to protect and produce antibodies against the virus that causes COVID, is very, very good. Some people have asked about, COVID and flu. Can you get those things together? Absolutely. There's no contraindication to getting them together. We give kids vaccines, multiple vaccines throughout their lives. Many of the childhood vaccination regimens are 5 or 6 doses, and they're oftentimes given 3 or 4 at once. And you have just the same immune response to each of those individual ones as you would have to a single one. We know that the vaccine has been proven in this randomly controlled trial to be about 95% effective in preventing infection, especially severe infection, and that's important. Let's talk about the side effects. So I think people want to know, what can I expect side effect-wise for my children if they get it? The number one side effect was injection site pain. I think everybody's had the COVID vaccination. Your arm is sore a little bit. The next one were sort of fatigue, headache, chills, muscle aches. But interestingly, remember, we have a group that got the vaccine, and we got a group that got placebo. That was the second most common complaint in those people as they follow them after the vaccinations. But those complaints were almost equal in the group that got the vaccine and in the group that didn't get the vaccine. So realize that there's some subjectivity to this reporting, and there was really not a significant difference between the vaccinated group and the placebo group in terms of these side effects. About 8% got fever, usually after the second dosage. And if you've got children, you know that they get fevers typically after their vaccine, their other vaccines, and that's because of that immune response. We see it in adults as well. They followed kids from the first dose until about a month after the second dose, and this was very interesting. About 10.9% of the vaccine group, the group that actually got the vaccine, reported some sort of side effect within that kind of, that 2-month period, meaning from the first injection to a month after the second one, about 10.9% of the vaccine group reported some sort of side effects. Interestingly, 9.2% of the placebo group also reported side effects. So very, very similar between the groups that got vaccine and the groups that didn't. There were 3 severe side effects in 2 participants that were seen. One of them was severe abdominal pain and pancreatitis after trauma. And that kid was in the placebo group, and another one was a fractured arm in a kid who was in the vaccinated group. And I think we can all agree that if you have a traumatic injury and you develop abdominal pain and pancreatitis, it's probably not related to the vaccine, and certainly the kid that got it was in the placebo group. And I think breaking your arm is probably hard to push as being a vaccine side effect. The kid that broke his arm was in the vaccinated group. So there were 2 kids that had what we would consider really severe things, and both of those things were really kind of obviously not related to vaccination. So hopefully that gives you a little bit of clarity and hopefully will guide your own decisions. Don't take my word for it. Do your own research, talk to your doctors. I think that's probably, your pediatrician is going to be by far your best resource for figuring this out. But it's important to get kids to protected against from COVID, and it's protective of the population as well. So hopefully this will help you. Please tune in for further videos if you found this useful. Follow us on Facebook and hit the little subscribe button on YouTube. Everybody stay safe. I'll talk to you soon. This is Dr. Jeffrey Galvin. Have a great day.